The world of partnerships is an interesting one. Magic Breakfast is a very simple concept. It's delivering free healthy food to children so that they can make the most of their lessons. We all know that a hungry child can't concentrate. Did you know that there's over 500,000 children in families that can't afford to feed them in this country? We've been working very closely with the food banks, we've been working very closely with the school food plan, and the numbers as a direct result of poverty are on the increase. We're now supporting 430 schools, feeding 16,500 children every day. It's a very small charity, there's only 9 of us in the team. And we packed that punch because we've been able to put together partnerships. And we've been able to do that with a level of passion and purpose that means that we've become the lead government partner on school breakfasts, that we're working now across a whole range of public areas, working with number 10, working, oh, hello, can you still hear me? Yeah. Working across, what happened to number 10? And what we have is a very simple proposition. We know that there are many children who wake up in homes with no food. And that's a kind of accident of birth. You know, that child did not make a plan, age 0, to be in that environment. And from our point, we're a very loving, optimistic group of people who believe in the great opportunity of each child to go on and do well, but not if they cannot make the most of their education and they're unwell. And you guys know far more than I do about the health consequences of poor diet. What we do know is that we've got to solve this problem for good. So our aim is to end child hunger as a barrier to education and future achievement. Health is kind of implicit in that, but why I wanted to come here today, and I was frustrated not to be able to get here this morning, was to kind of work out how we can integrate what Magic Breakfast does with the public health professionals. We know that there are school nurses whose jobs have changed radically as a result of the rise of hunger and malnutrition. We know that there are public health professionals all over the place who are saying, how are we going to solve obesity? How are we going to make sure these children get a good preventative message? Well, you know, delivering a healthy breakfast, making sure children learn those early healthy eating patterns seems to go a long way, seems to be a good thing, and we can do it for 22p a day. So I'm quite lunatic, really, about the need to make sure we don't have hunger in our schools and we don't have families that are just fearing for the future of their kids because they can't afford to put food on the table. I don't think that's right for this economy.